The U.S. is now averaging 100,000 new coronavirus infections a day. It is another reminder of how quickly the aggressive Delta variant is spreading across the country. Joining us now is clinical nurse specialist Alice Benjamin. Nurse Alice, good to see you. Good morning.
Good morning, everyone.
All right, so let's start off with the big announcement that Governor Newsom made last week. He said all healthcare workers have to be vaccinated by the end of next month. Do you think that kind of sweeping mandate is crucial? And what kind of response is this getting from healthcare workers?
I think that it's a very crucial announcement. It's something that's very important, especially if you think about the timing. September, we're going to be entering into flu season. I mean, who's thinking of flu? But yes, we're going to be entering flu season. So it's important that we get our frontline healthcare workers, people who are in close and frequent contact with the public, vaccinated and unvaccinated, that we protect not only ourselves, but our public, because we could potentially be spreaders ourselves if we are not vaccinated as we're taking care of people. So I think it's very important, a little bit mixed feelings, but I think if we're thinking of the greater good of the public, of our families, of ourselves, we know it's the right thing to do, Adrian.
All right, and let's talk about the rapid rise in COVID cases. Last week, LA County's health director says it seems to be tapering off. Are you feeling a little bit more encouraged than you did a few weeks ago?
No. Maybe tapering off. Tapering off does not mean zero. So I'm just going to be hyper vigilant because I'm a mother, and I'm on the front line. So I'm seeing this day by day. Our infection rates have increased, our hospitalization rates have increased, and our death rates have increased. Mind you, they're not as extreme as they were last year, but the trend is still in the wrong direction. So, but if we can get people to do the right thing, get vaccinated. If you're sick, stay home, wear your mask. Then we can really, truly get those numbers to go back down. But right now, especially as kids are entering back into school, we know flu and cold season are coming in. I really want us to be cautious and not get too ahead of ourselves. Maybe it's a little bit tapering down, but let's get to zero. That's where I want us to be.
And you just mentioned, I mean, you're a mother, parents with young children. They find themselves in a delicate situation. A lot of moms and dads who are fully vaccinated are still waiting for their younger kids to get their shots. So what's the best way that parents can protect their children? And what activities should parents feel comfortable with right now, if any at all?
Yes, I think it's important that parents talk to their kids about what's going on with COVID. What does COVID look like? If they're not vaccinated, get them vaccinated as soon as possible. But if they can't vaccinate, they're 12 and under, talk to them about what COVID looks like, washing their hands, wearing their mask at all times. Don't share your mask with your buddies. I mean, let's talk about precautions. But inside your home, what do? Mom and dad go out the house, they come back to the kiddo. Kiddo's not vaccinated. Well, in your home, unfortunately, especially as we're seeing Delta, I've actually encouraged some parents to wear masks in their home around their children, especially if they're having frequent and prolonged contact with unvaccinated people. I mean, it's not necessarily the thing we want to do, but it's the best thing we can do to keep our kiddos safe. And, we all love our kids, and I tell my son all the time, wear your mask, wash your hands. And I do what I can to kind of stay away from my sons, especially if I know that I've been in the ICU and around a lot of sick people and, a lot of sick people out there in the ICU. And I want to make sure I protect my kids at home.
And the last question we have for you, we're in the peak of the summer travel season still, and many people are wondering whether it's safe to go on vacation with the spread of the Delta variant. What do you recommend for anyone thinking about heading out of town?
Well, the CDC guidelines have not changed. If it is not necessary travel, you should defer it. That's something that's very important. Also, avoid travel if you're not fully vaccinated. That's something that's very important. Wearing your mask, physical distancing, at least 6 feet is still important. Washing your hands. And also, depending on where you're traveling, look at the infection rates, hospitalization rates, death rates of where you're going. And when you come back, quarantine yourself. I mean, maybe it's not required, but you should self-quarantine yourself to make sure you're doing the best thing and get tested about 3 to 5 days after you return to see if you may be positive. We're seeing more vaccinated people also test positive and asymptomatic. So, we just got to take these precautions and don't wait for someone to tell you to do these things. Let's do the right thing for ourselves and one another.
All right, Nurse Alice, always great to see you. Thank you for your time this morning, and thank you for your guidance. We appreciate it.
Thank you.
All right. Thank you, Ms. Nurse Alice.